Hi, this is Alicia Bright. We're going to discuss the concept of cognition in preparation to discuss care of stroke patients and patients with delirium. So I'm going to digress for a moment, a little Enlightenment philosophy here. René Descartes was a famous French philosopher who had a strong influence on how we think about what it is to be human. And he said, cogito ergo sum. You'll hear this phrase if you listen for it. It means I think, therefore I am. And it implies that as we have these cognitive processes, so are we human. So do we know our relationship to ourselves and to the rest of the world. So this is essential to being human. And Giddens addresses this. Giddens says that cognition is the process of thought that embodies perception, attention, visuospatial cognition, language, learning, memory, and executive function, as well as the higher order thinking skills of comprehension, insight, problem solving, reasoning, decision making, creativity, and metacognition. So this is kind of everything that we do that has to do with thinking and processing information. So you'll hear these phrases used in the clinical context, somebody who is cognitively intact versus somebody who is cognitively impaired. Cognitively intact basically means that individuals are exhibiting behaviors that are within the normal range for their age and culture. And cognitively impaired means that there's something that's definitely off. There are observable or measurable disturbances in at least one cognitive process. We're going to talk about some of those processes and what they are. So first, I want to stop for a moment. If we were in the classroom, I would draw this information out of you, but I want you to think for a moment. If you've got somebody who is cognitively impaired, what does that mean in terms of the nurse's ethical responsibility? So if you remember ethical principles, well, you haven't maybe studied ethics yet, but you're going to learn about ethical principles. And one of the ethical principles that governs nursing interactions is the idea that people can make their own decisions, right? That the idea that people have autonomy and that we respect their autonomy. This is the ethical principle behind surgical consent. Remember, we talked about getting surgical consent before any procedure, invasive procedure. This is because our ethical system calls for us to respect someone's autonomy by getting consent. Now, what do you do if their thinking is off? If they're just not quite right in the head, if they are cognitively impaired? Well, what if you've got someone who's cognitively impaired and who is refusing treatment? And you know that they can't really process the results, what might happen if they make that decision to refuse treatment. In that case, we start to be governed by the principle of beneficence, or doing what we think is best for the patient. And it's very difficult to not slip into paternalism. Paternalism is a problem. The idea that we know what's best all the time. But you'll find a lot of times in clinical, people are a little bit off. They cognitively can't quite think clearly. And we're going to be discussing today situations in which people aren't quite thinking clearly. It's an ethical gray area. We need to be very careful. Actually, it's not really a gray area. It's a very delicate balance that we strike when we work with people who are cognitively impaired. Anyway, brief introduction first, and then we're going to get into the nursing care and subsequent lectures. So, this chart by Giddens demonstrates the continuum between cognitive impairment with basic cognitive functioning in the middle there and higher order cognitive functioning. So you'll notice that this continuum only goes one way, right? It's not a balance. Or it's not like blood gases and we're trying to balance the pH here. You're either impaired or you're heading in the right direction. So basic cognitive functioning includes perception. You know, what do you see? What do you feel? What do you smell? It includes pattern recognition. Can you understand language? Can you put ideas together in your head in a very basic way? And can you pay attention? Uh, can you focus on what somebody's saying to you, for instance? Higher order cognitive functioning. Uh, this is when we get into what you're doing right now: learning, comprehension, developing insight, uh, problem solving, reasoning, decision making, creativity, and something called metacognition. Um, so I will say, before we talk about metacognition, this business of higher order cognitive functioning, this is why when you're writing your care plans, if you have someone who is cognitively impaired, it is very difficult to teach them to do health education with them. They're not going to get it. But the caveat there is that people will get it to one extent or another. So your Alzheimer's patient will not necessarily be able to, maybe they're impaired to the point where they can't remember tomorrow the instructions you give them today. So your teaching plan is not going to include educating them on how to monitor their own blood pressure at home, for instance, right? Your teaching plan is going to focus on reinforcing what you're doing from moment to moment. It's going to be reinforcing what day is today, where is this person right now, what are we going to do next, it's time for lunch, whatever it is, it's very much immediate in the moment. So this cognition also has implications for patient education. If somebody is cognitively impaired right after surgery, for instance, they're on a lot of narcotics, they might not remember what you're going to tell them. You might teach them anyway, but recognize that they're not ready to learn it. Anyway, let's talk about this metacognition. Metacognition is thinking about your thinking. And this is really the part that makes you a better student. So I'm going to talk about you for a moment. When you reflect on what you're noticing and what you're feeling and what you're thinking, seeing, what are you wondering about? What are you curious about? If you take one step back and see if you can become an observer of your own thoughts, that's metacognition. And practicing that will make you a better thinker. That's why you're going to get a lot of reflection papers assigned to you throughout the nursing program. And we encourage you to think about how you think. Think about how you learn. Notice what you're noticing, because that will make you a better thinker. And we use this to measure level of awareness. And I'm going to give you a brief introduction. I don't know if you got a chance to see this or not in the hospital, but the Glasgow Coma Scale is used commonly as a way of measuring where someone is at in terms of cognitive function, and we look to see whether they're getting better or whether they're getting worse. Somebody who's had some kind of a brain injury, a stroke or a traumatic head injury or something like that, they may be getting better and they may be getting worse. So we use this to track that. Now, I want you to notice, if you look at this, on each of these scores, we look at eye-opening, verbal response, and motor response. And on each of these scores, you get a point for showing up. So you could be brain dead, basically, and have 3 points on the Glasgow Coma Scale. Just saying, it's a quirky little thing about this scale. But somebody who opens their eyes spontaneously, best motor verbal response is that they're oriented to time, place, and person, and they can, obey commands. These people have a Glasgow Coma Scale of 15. If they open their eyes just to speech or to pain, they get fewer points. If they get oriented, if they are using inappropriate words, if they're confused, they get fewer points. Incomprehensible sounds are fewer points. And for motor response, sometimes if somebody seems to be non-responsive, we'll heavily stimulate them and then try and get them to give us the thumbs up or some kind of indication that they can follow commands. If they don't do that, if we can't get any good motor response out of them, we might do something that causes pain. Commonly, they'll pinch the fingernail a little bit, and what happens if somebody pulls away from that pain, it's just something that doesn't damage them, it just hurts. If they pull away from that pain, they get a 5. There are people who just flex that whole part of their body. They get a 4. If somebody is posturing, we call it, it's just a general, it's a very low form of response. They would get a 3 or a 2 depending on the form of the posturing. So we use this to track how well people are doing neurologically. So let's talk about risk factors a little bit, because basically we want to keep everybody healthy, right? And so we spend a lot of time and energy doing prevention. And actually we should be spending more time and energy doing prevention. Hopefully our public health system will evolve in that direction. So I want to go over, this is again where I want you to think about different things that we do or could do that are risk factors for cognitive impairment. So risk factors that have to do with personal behaviors may have to do with using drugs or alcohol. There is no faster way to get cognitively impaired than to go out and tie one on at the bar. That's one way of decreasing your ability to make rational decisions. Other ways that we can actually put ourselves at risk are, for instance, not using helmets in active sports. So we've had a rash of people with head injuries, with concussions in football, for instance. There's been a lot written about chronic head injuries and repeated head injuries that are associated with football that helmets don't even help with. But, you know, when you're out there riding your bike and doing other things, wear a helmet. Environmental exposures. We've got a famous case of an environmental exposure in Flint, Michigan, a few years ago. It's still a problem. If you remember, the pipes were changed over to take caustic water out of the river. This was to save money. From the company that was running the water project and for the city of Flint, Michigan, changed the source of the water in order to save themselves money. And that water went in and deteriorated the lead pipes, the old lead pipes in the system. And it was a pediatrician, actually, that noticed that suddenly her patient's blood levels of lead were going up, up, up. So they were exposed to lead. These kids, some of them had lead levels so high that they will never develop normally. Adults were also exposed to high levels of lead, and this decreases cognitive function. This is why we've got strict regulation. The EPA regulates lead. We don't put lead in paint chips in paint anymore, so we don't end up with paint chips with lead unless it's a very old building. But we do have problems with lead in the drinking water in this country. It's another public health issue. There are problems with things like mercury also. Carbon monoxide. That is an environmental problem that causes brain problems. Some insecticides cause problems with cognition. There are genetic and congenital conditions associated with this. Things like fetal alcohol syndrome or before the baby's born, if they get exposed to cocaine or methamphetamines or other drugs. They can affect them cognitively. There are also some chromosomal abnormalities like Down syndrome or Fragile X syndrome. Phenylketonuria could end up causing congenital problems if it's not caught and treated. You'll get more about that in pediatrics. And then, of course, any other health-related concerns, and that's what we're going to kind of focus on in the next lecture. Health-related concerns like fluid and electrolyte imbalances, infections can cause delirium, can cause septic shock, fever, pain, hypoglycemia. Different drugs can cause problems. Medications. tumors, strokes, chronic conditions, lots of medical problems can cause cognitive impairment. So you'll find that there are a lot of folks that we deal with in the acute care environment who have cognitive impairment. So what are the consequences of impaired cognition? How many can you list in 2 minutes? I would like to do this as a little breakout session, but since I'm talking to myself in my living room, I will fill in the blanks here. So, of course, if you've ever impaired your cognition by partying too much, you'll understand that there are some, you might make some bad decisions if you're impaired in that way. That's one reason to avoid overdoing it. Of course, people who are, for instance, think of somebody with Down syndrome. A higher functioning Down syndrome person might be able to manage living independently with a lot of support, with coaching. They may or may not be able to manage their finances. They may or may not be able to hold a job. I've seen a couple of times I've found people with Down syndrome working as baggers at grocery stores, and that's fabulous. It takes in a supportive environment for them to be able to do that, but they can. And some people with Down syndrome are very dependent and can't live independently at all. They can either live with their family, or if the family can't handle them, they might end up institutionalized. Stroke patients may or may not be able to manage their finances, for instance. There's all kinds of different ways in which cognitive impairments put you at risk for physical, psychological abuse. You can't problem solve as well. People with dementia obviously will gradually lose their ability to navigate their lives. Managing finance is difficult. The ability to function can be impaired. And so this can be a huge burden for caregivers, very exhausting. And I know some people who've had, for instance, Down syndrome patients in their family, and those folks are absolutely beloved, and they bring something wonderful to the family, even though they need a lot of support in order to function. So there's a lot more to it than pulling your weight. Sometimes people are there to lift the rest of us up. Nothing against that. But we need to take this into account when we're helping people function and make rational decisions about what they're going to be able to handle or not. Okay, so how do we keep the brain healthy? Well, this slide should actually look very familiar to you. You should notice that a lot of the things over there on the left are the same things that keep your nervous system healthy. By the way, a lot of the same things that keep your brain healthy are the things that keep your heart healthy. So for more information on brain health, refer to our cardiovascular health process. So exercise, being in nature, social support, huge. Intellectual activity is also very important. Avoiding smoking, moderation or abstinence for drinking, getting enough sleep, good nutrition, and then helmets and so forth. Protective gear. So I just thought I'd share this little tidbit with you. I love it. The human brain is awesome. It functions 24 hours a day from the day we're born, and it only stops when we are taking an exam or when we fall in love. There you go. Now we're going to move on and talk about delirium and stroke.